Hello, I'm Christian Barnick, and I'm a consultant at OBGYN Matters, a private clinic in central London. I'd like to talk to you a little bit today about the menopause, early menopause, and fertility. I see many women coming to see me now concerned that they're risking their chances of having children by putting it off. These days, it's not at all unusual for women to be in their late 30s and not have had children. In fact, the average age in the UK is approaching, for childbirth, is approaching 35. So it's not surprising that there are a lot of single women out there who are worried that maybe they're leaving things a little bit late and how this might affect their fertility going forward. Now, fortunately, for most women, the menopause doesn't come until about 52. But this means that their eggs are running out at that point. It doesn't tell us anything about the egg quality. And of course, women also understand that the egg quality reduces as they get older. And this effect is mostly seen after the age of about 37, 38, where fertility rapidly reduces. As I said, fortunately, very few women suffer from a premature menopause. But there are a number of groups in whom it might be appropriate to be considering this a little bit more carefully. One of these groups are women with endometriosis. Endometriosis is extremely common. Women can often have large cysts on their ovaries, and these can damage the ovary and reduce the remaining egg count. On top of that, these women often have surgery, and during the surgery, the egg count can be reduced still further. So you can see how in this group, the issue of how many eggs they have left becomes a very serious problem. And there are those of us who are pushing quite strongly that women with severe endometriosis should be considered for early egg freezing under the NHS, in just the same way as women will be considered for egg freezing if they're going to have chemotherapy for cancer. So if you have a condition like this, it's really important to be thinking carefully about when you're going to time having your children. But as I said, this is only if the disease is severe and affecting the ovaries. Another group, of course, will be women who have other medical conditions, and in particular, autoimmune conditions, which can also affect the ovary, damage the ovaries and lead to an early menopause. If you're concerned, do go and see your doctor to discuss this, because it is a really important issue. And because of it, more and more women are now coming forward and having their eggs frozen. But beware, egg freezing is not quite the insurance policy that you might imagine, because there's a high attrition rate. And you need to really have somewhere in the region of 30 eggs frozen to be confident that you'll be able to achieve a baby from this insurance policy. When it comes to the perimenopause itself, women find that they will have less frequent periods, and this is because they're not ovulating so regularly. But usually by this age, the eggs are also no longer of a suitable quality for them to become pregnant. Ultimately, when you reach a certain age and you're no longer sure if you're going to have enough eggs to get pregnant, the only way to find out is actually to go through a stimulation cycle and then to freeze the eggs, or better still, fertilize the eggs and freeze embryos if you have a suitable partner. So this whole issue about when to have children, whether or not to freeze eggs, how long women can wait to have children is a really contentious one. I worry a little bit personally that sometimes women don't think about these things early enough in their lives and can then perhaps find themselves in a very difficult position in their late 30s or early 40s where they're finding it difficult to have children. So do be careful. Do think cautiously about your individual circumstances and whether or not you might be at greater risk than someone else of fertility issues and indeed even a premature menopause. we're always there to help. And so, of course, please do just get in touch if there's anything we can do.